Hello and welcome to the Situation Report for Thunder Bay Regional Health Sciences Center's COVID-19 response. My name is Tracie Smith, and today I'm here highlighting yet another staff member who has been through it all with this COVID-19 pandemic, supporting all of the operations and making sure that patient care continues. It's an absolute pleasure to welcome you today. This is Michelle Hurlbert, and you are a switchboard operator.
Correct. Thank you, Tracie. This is just amazing to be here. Thank you so much.
Thank you for sharing your experience. I think it's really important that the community understands the impact to all areas of the hospital. Now, switchboard is a very busy area at all times.
Correct. It definitely is, especially now. Yes.
So what are things like on a normal day, sort of pre-pandemic, for the switchboard?
It would be what we call a steady or busy day. But when the pandemic happened, the impact on calls that were coming in were just enormous.
What kind of,
the calls that we get is the emergency still open? You know, what are the hours, visiting hours? You know, can I come? And it was just, the impact on the public calling was tremendous.
So were you able to help people during that time? I would imagine that they were very anxious and just looking for answers.
Oh yes, via emails with communication throughout the whole hospital. We had the communication of how to answer calls and, you know, what is going on in Thunder Bay, and especially what is going on here at the hospital. So it was very easy because the emails would come in daily, hourly, minute, just changes. We were able to tell the public, this is what's going on now. So it was great that way.
You and your colleagues had to be on top of all of that information, not just the changes going on in the hospital, but as you said, in the community. What was that like for you? How did you stay on top of things?
The news. The news. I think I was on every news site I can think of. And I wasn't on Facebook a lot because I didn't find that was very helpful. But yes, the news for sure, and emails here at the hospital helped tremendously because they were changing all the time. And it wasn't just even community, it was worldwide, so yes.
So in the midst of all of this and answering all of those calls and trying to support community members as much as you could, you're still handling things like emergency codes.
Oh, yes.
So if someone, for example, went into cardiac arrest in the hospital, that was something you obviously still had to coordinate.
Yes.
What was that like?
Well, for that, with the code blues, code strokes, code STEMIs, we did have some changes. So we did have procedure and policy changes when the pandemic happened in order to keep all the staff safe. So our codes changed to protected, and we had to know which codes to use those for. So it was just knowledge with keeping up, that's all.
How did you feel? Did you feel safe?
Coming here, definitely.
You did?
Oh yeah, like I said, the communication here was really well. Emails were always coming in. They were very informative. If you had any questions, you always had someone who would have the answer for you. So coming to work, knowing that, you know, people are being screened, wash your hands, wear masks, we knew that we were safe coming here. I felt safer coming here than going grocery shopping.
How did your friends and family feel? They must have had a different perspective.
Well, I know with my parents, it was a lot about just communicating what I knew. My oldest sister works here at the hospital. She was informed too. And then so my other sisters, we would just communicate in ways that were different because you couldn't go to their houses anymore. Yeah.
What other sort of precautions did you have to take on a personal level, or sacrifices made on a personal level because you work at the hospital?
I fortunately didn't have the sacrifices that some people did, but just for one, like I was helping out where I was doing the grocery shopping for my parents so they didn't have to go because they are seniors and I didn't want them getting sick. Teaching them how to clean the products and all that, their food, when it got to their house. Yeah, just those kind of things. But to me, that wasn't a sacrifice.
What would you say was the biggest impact for the switchboard operators?
I would have to say the impact was the enormous amount of phone calls that came in from the public. And for us, it was really heart-wrenching at times because you want everyone to have that information, but we only have so much time on one call. So yes, just trying to, have the empathy towards the public that are calling in with all the questions.
Do you find that the questions that community members have changed over the course of the pandemic?
Yes and no. We still get, the same calls that from originating, like visiting. That's a whole concern. But at the very beginning, it was more trying to connect families because people couldn't visit. So that was one of our priorities on top of, connecting our doctors to doctors. But yeah, it was just more of a connecting of people. Yeah.
So what did you learn from this experience? What do you take away from it?
I learned that communications have changed. You just can't go to someone's house. It's now about, either messenger, texting, phone calls. It's kind of gone back to the old way of, picking up the phone to talk to someone. It is nice with the messenger video. One thing, too, that I've learned with all this is that no matter what happens in life, things can be worse. Yeah, things can definitely be worse. So just day by day, keep a smile on your face, get the sunshine if you can. Yep, yeah.
It's a great perspective. It kept you going.
Oh, yes, definitely, yeah.
What are you most proud of in terms of our hospital's overall response?
Oh, gosh, I have to say, I am so proud of the staff, all the staff that work here. With hearing of all the staff that put not themselves first, putting patients first, putting their safety aside, their families aside, just to help out on the COVID unit and, come into work and not knowing what you're coming into, not knowing if you're safe. Very proud of all the doctors, nurses, administrative, housekeepers, porters, you name it, everyone that works here, just to come to work.
Well,
yeah.
We're proud of you. Thank
you.
you
Thank
for
you so
your
much.
dedication, for coming in every day
Thank you,
throughout
Tracie.
this pandemic, and for your commitment to patients and families.
Thank
Thanks,
you so
Michelle.
much. Thank you.
And thank you for watching.